Unfortunately, there are certain conditions a baby may have where we can't fix it, and even the surgeons afterwards can't fix things. And in that scenario, we have a team of nurses who meet many times with the patient throughout the pregnancy to develop a birth plan to make that the best experience we can for a couple that's going to have a life-limiting condition. I think it's made a big difference for the women of Central Texas having access to these programs. You don't have to go far to get the same quality of care. So everybody has an ultrasound at 20 weeks. The baby's big enough to see everything. And it's there that, unfortunately, a pregnant woman thinking everything is okay is told her baby has a birth defect. And then that patient, many times from the OB's office, will be sent to a maternal fetal medicine's office who will confirm the anomaly, and then based on the type of anomaly, will refer to us for delivery here at the SDU. So the beauty of the center is the patients get to meet the doctors that are going to take care of their babies right after birth, whether it's the neonatologists who are high-risk pediatricians, or it's the surgeons that are going to operate on their baby. Before the SDU and the fetal center existed, moms would deliver at other hospitals around the greater Austin area, Central Texas, and then the baby would be separated from the mom and transported by ambulance to where they needed their care. The concept of the fetal center and the SDU was keep mom and baby together, right? Which makes the most sense. Mom wants to be with her baby who's going to go to surgery. So with that, the SDU, or Special Delivery Unit, was then created.
What's special about the SDU is that we give this care to these patients where their outcomes aren't even known in the beginning to be optimal, and then we start taking care of the mom. And the fetal center takes care of the baby, and then they work in collaboration. It is incredibly collaborative and incredibly detailed. Every week they have a meeting. How many weeks is this mom? What does she need?
The heroes are our nurses that are working on the floor with these patients every day. They're amazing, they're compassionate.
In their most difficult days, our staff, our associates here, carry them. We prepare them along their entire pregnancy and then go with them through the delivery and either to NICU or the cardiac critical care unit.
The Specialized Delivery Unit, also known as the SDU, it is a place that we were able to bring moms and babies together. Previously speaking, we had to deliver moms at another hospital and then ship the baby to this hospital. It was very challenging for those families to be torn and to be divided. One of the opportunities that we've had is being able to deliver moms safely inside a pediatric hospital, inside the hospital where the baby will seek their care, giving them that opportunity to go be with the baby as much or as little as they need to be and be present so that the care teams can actually come talk with the patients directly versus over the phone. Ensuring that, safety is the first thing that we always want for our patients and their families, but making sure that every experience is tailored to what they need.
And not having to travel as far and disrupt their family by having to move to another city, maybe even take up residence there while their baby's really sick. They can stay here and get the same care.